The Albuquerque Hispano Chamber of Commerce Convention and Tourism Department is the proud iPad sponsor for New Mexico Living.
Your mouth can speak in more ways than just using words. That's why dentists have the ability to make judgments on your health based on the signs they see when conducting an oral examination. So, here today to tell us about some of the common health concerns they come across in their line of work, we are joined by Dr. Kartik Antani, who is a dentist with Napa Family Dental. Welcome to the show. Thank you for joining us today.
Thank you for having me.
Okay, most people think dentists just deal with teeth, and that's true to a major extent, but that's not all that you guys do. What kinds of overall health issues can actually show up in the mouth?
You know, there's a lot of things that can show up in the mouth, and we can take something as serious as oral cancer, which can be a manifestation of other cancers in the other parts of the body. Autoimmune issues, such as Sjogren's syndrome, a lot of other autoimmune issues, such as connective tissue disorders. Those are all signs that we can see in the mouth.
Yeah.
Of course, things like gum disease, which can be part of diabetes, heart disease, things such as a lot of erosion on our teeth that can give us clues of the patient's stress levels, their anxiety, digestive issues. A lot of different things can be visible in the patient's mouth.
Yeah. Can you give us an example of maybe where a dental exam uncovered maybe a serious health concern in a patient?
Yeah, I mean, it's rare, but it's very, very, very sad when it happens, when you see someone have oral cancer. And when they have oral cancer, it typically can be caught earlier and managed, but sometimes in rare occasions, it's too far gone.
Yeah.
More commonly, we'll see signs of gastric issues. We'll see signs of sleep apnea, actually, which is what we screen for all the time. And of course, you'll see people that have issues with cardiology and, let's say, diabetes or other endocrine issues. They come in and we can see those signs in their gums.
Just from like an oral examination, essentially?
Well, yes. We also take a complete and thorough health history.
Okay.
So then you put together the pieces to the puzzle. And then if you find someone that has, let's say, uncontrolled gum disease, or they're just doing their best and it just can't get under control, it's a possible complication of diabetes.
Wow.
And of course, that can make the diabetes worse.
Yeah.
So there's a lot of things you can see in the patient's health history, in addition to the exam, in addition to talking to them and seeing how they feel overall.
Yeah. As a dentist, why would a dentist be able to maybe spot something that maybe a medical doctor wouldn't?
You know, I think it's, first of all, it's based on frequency, right? So most people should be seeing the dentist every 6 months or so. Some people should be seeing the dentist a little bit more frequently if they have a higher risk of cavities, a higher risk of gum disease.
Yeah.
So we see them more frequently. Sometimes we have more time with them because we may be seeing them for active treatment. So we get to interact with them more. And every single time they come in, we update their health history, we check vitals. Every time they get any kind of anesthetic, we check their vitals. So we may be able to see more of what's going on with their systemic health just based off of the frequency.
Wow, that's crazy to think about. Like something like that, something in the mouth could affect the entire overall body. What are some subtle signs people might not think are that big of a deal? They're brushing, maybe they feel some pain. What are some things that people deal with at home that they shouldn't ignore?
So pain for sure, never ever ignore. And it doesn't have to be a tooth pain. It can be jaw pain, it can be gum pain. It can be pain like headaches when you wake up in the morning and you don't feel right. You feel tired all the time. That can be a possible sign of sleep apnea, which can lead to grinding.
Yeah.
And of course other issues. Bleeding gums, any kind of discomfort, any kind of situation that's not normal, that's probably something you should talk to your dental professional about.
Yeah, don't just put it off. Seriously, if you're seeing blood, feeling pain, like you said, it could be the cause for something much bigger than just the pain in your mouth. It could be something else affecting that. If there's someone out there who hasn't been to the dentist in a long time, they're like, I feel fine. I feel totally fine. Why would I need to go to the dentist? What would you say to that person?
I say, you should go every 6 months if you can.
Yeah.
If it's been a while, no one's going to judge you. Just go get looked at, because worst case scenario, it could be something very, very detrimental to your overall health, even morbidly, something like cancer, right?
Absolutely.
Now, best case scenario, you go in, you got a clean bill of health, and now you can just stay on track every 6 months. Things don't hurt until they get really bad. So, for example, a small or medium-sized cavity probably won't hurt until it hits the nerve, and then now you need a root canal or an implant.
Oh.
Or a small cancerous growth that can be taken out may not become an issue until it's spread further into the jaw, further into the body. So just get checked out.
Yeah, taking those early prevention methods can maybe help in terms of discovering something much bigger, right?
Right.
Helping you down down the road. Let's talk about Napa Family Dental. I want to talk about this, your dental practice and why people should come to you guys.
I think they should go to any dentist they can get
to.
Of
course.
But they should come to us in case they're interested in certain types of treatments, such as sedation dentistry. A lot of people are scared to go to the dentist, and we get it. I always tell my patients, if I wasn't a dentist, I probably would be scared too. Okay.
Yeah, right.
We also offer a more comprehensive approach to TMJ solutions, to sleep apnea screening, to refer them to the right doctors. Yeah. And I just think that we try to keep it small. We have a small team. It's just me, one hygienist, and it just makes it so it's more personal. But I think, come to me if you want to, otherwise go to someone you can, because this is very, very important to get checked out every 6 months.
Why do you think people are so afraid to go to the dentist? I feel like that starts for children, and then it goes into the adulthood. Why is that?
Well, I think it's a lot of stigma from past ways of treatments, and I don't think it's just dental. A lot of medical professionals, kids don't like going to the pediatrician sometimes.
Right.
They get scared of the shots. I think it's also just past experiences. Some people will develop bad anxiety with dentistry even as adults. So I think it's based on how they get treated. And sometimes it doesn't have to do with pain. It just has to do with, I wasn't heard, I was talked down to, and certain things that can really make it a barrier for people.
Right.
And I think that's a conversation that maybe we should get into a lot deeper, because it affects a lot of people.
Well, I'll let you guys know this. When you go to Napa Family Dental, you're going to feel like family walking in there. It's in the name for a reason. If we want to get a hold of you guys, where can we go online to find out more about you guys?
Yep, our website is napadentalabq.com. They can Google us. It's very easy to find us.
Yes, guys, Google that, Napa Family Dentistry. And don't put off those dental appointments, guys, just to get a checkup. It's really, really important for your overall health and well-being. Doctor, thank you so much for joining us today. Appreciate the conversation.
Thank you for having me.
Absolutely. Guys, for more information on this entire interview, head over to KRQE.com, click on the New Mexico Living tab. All right, don't go anywhere. There's more New Mexico Living headed your way right after the break.